one thing positive throughout all of this craziness that's happening in the world. In Iowa, anyway, where I'm from, I've noticed more people waving when you pass them.
Yes.
And when we drive by or somebody's walking on the street, because beforehand, nobody waves, nobody does anything. But it's just kind of like, hey, I'm glad to see you. And I'm glad we're all here. And we're going through this. And we're going to make it through all of this together. It's a nice thing in that aspect.
It could be the shirt you're wearing. You know, everyone's like, "Hey,
Bush Light,
Bush Light, you're wearing that."
That guy down.
Like, this guy knows.
I'm gonna wave at this guy right
guy
here.
definitely knows.
Yeah, I'm definitely gonna wave
people
at
are just
him.
so hungry for human interaction,
dude.
Yeah,
that when we see anybody, even a stranger, it's like, "Hi, I'm 6 feet away, but hi."
But isn't that funny, man? Like how quick we realized how much bullshit we take for granted on the day to day. It's crazy to me, man.
Yeah. And I think it's also forcing the hand, like, you know, like things are getting negative and people are being shitty towards one another. And like, you know, now the universe is like, all right, let's force you guys to be a little bit nicer to each other. And these are shitty circumstances. They're awful. This is awful. However, I am, you know, like you said, Johnny, I'm noticing that too, that people are being kinder. The majority of people are being kinder to one another. We're looking each other in the eye. We're waving. Our
town, there's a little girl today who had her 9th birthday party. So the entire town created a parade to drive by her house and honk.
That's awesome.
Like, everybody in town did it.
I love it.
I mean, that's incredible.
I've seen that a lot. You know, the cool thing about all this is there's starting to be more interaction on social media, if that needs to happen. But it's happening in a positive, I feel, because social media, right? It was like very negative and very positive at both sides of it, right?
Sure.
But I feel like more people are using social media to get the message out, to talk to one another, to interact like we're doing right now.
Yeah.
Right. And I feel like there's more communication and a positive rather than like, let me jump on the keyboard and just, you know, say some BS about this person over here really quick, or say, oh, I hated that movie over there, or whatever. The stupidity of social media is half the time, you know?
Yeah.
But I do realize that, like you're saying, Johnny, Chad, and Josh, that there is more interaction in like this kind of interesting way of if you're driving to go to the grocery store and somebody's waving or like keeping their distance, or just making sure you're okay, or getting on something like this and communicating with each other, checking on each other.
Right.
So, and I think that's what the times kind of need. It's hard when you're locked down in your house or wherever you are in the world, then you're isolated and you're just by yourself, or something's happening, or you have to take care of your kids, or whatever we do in our everyday. That's why I find it's just an interesting time right now where we're kind of coming together in a sense, which it should be. But don't you think it's like kind of, I don't know, ridiculous to think in the sense of we have to have something this dramatic happen for people to come together?
Yeah.
You know?
But
I mean, it seems like people don't realize how powerless they are until a tragedy happens.
Exactly.
Sadly.
Yes.
Sadly.
Until it happens to you.
Yeah,
I have no sympathy. I'm okay. I'm okay until it happens to me or you or a loved one.
Yeah.
Then everything, the world ends, the world stops, right? Why does it have to be to that point, though, you know, for us to get like this?
It's very sad that it does.
Yeah.
I mean, there's no excuse.
There's no excuse, and it doesn't need to come to this, you know. But man, yeah, I don't even know what to say sometimes. You know, like every day I'm shit astonished.
Well, I mean, it's a part of being human, right? I mean, we all do it in a sense, in a weird way, but we try to stay grounded and remember, you know, we are just human. We make mistakes, whatever. But I mean, I think we're doing a good thing right here, bringing people together on the G Crew. You know, talking of different people, all walks of life, and you know, that's why. Speaking of positive, I'm really happy to bring on my cousin tonight, Caitlin. And Caitlin, you know, and I grew up together in New England. And, you know, I just heard that she came down with the virus and I had no clue. And I didn't know I had no clue that she had it. I didn't know what was going on. I just was notified today that, hey, she just came out of it. So, Caitlin, I'll let you talk all about it and everything, but welcome to the G crew.
Welcome.
Yeah, welcome.
Thank you.
I feel like you've been a G all your life, so you're just now here hanging out since we're family. It's crazy. So my mom tells me today that you had this virus and I had no clue. And how long have you had it? Just walk me through everything.
I'm so surprised. She's a little late to the party. Usually she's on the ball with that information.
I know. And isn't that scary though? It's like, I just found out today, you could have been severely ill in the hospital.
Yeah.
I wouldn't even known.
Honestly, I live at home alone, and that was my first thought, that this is really scary. Like, what if it was worse than what it actually was? Myself and many of my coworkers, I'm a nurse. I'm a nurse. I have a background in emergency med surg, and I also am an adjunct professor at a community college. So I'm very busy. Yeah. I stay busy and I stay active in the community. And where I was obviously sick, and I knew that any sort of illness now is questionable. Everything's questionable for COVID. In my experience, people who come into the ER with abdominal pain, we test for COVID now. Yeah. It's ridiculous. Somebody will have abdominal pain and their CAT scan will be totally fine, where we're trying to rule out appendicitis or gallbladder issues. It's their lungs that are actually the problem. But for myself, it was just a simple head cold. I was fatigued. I couldn't smell or taste. And those were the key factors, not being able to smell or taste. And that was it. And just congested. It was a mild cold, and that's all there was to it. But for other people, it's awful.
Yeah.
I don't know. It's different for everyone. My coworker and I both had the same symptoms, mild symptoms. She couldn't smell or taste. Those were the key factors. And every day we learn something new. Every day I go to work and something's changed. There's a new protocol. I can't keep up. I can't keep up with a nurse. I really can't.
I was going to ask about like you being a nurse or whatever. What is the atmosphere like right now? Because I mean, as we sit here basically isolated in our homes, all we're getting is just, different things and bits and pieces from the news. You're right there on the front lines.
That's a great question. To be honest, I love my job and I love what I do, but I hate going to work right now. I really, truly hate it. I'm thankful I get to interact with people, but it's not the same. We're covered in what we call PPE, protective gear. Yeah. The communication has lessened. We're distanced even at work. Taking care of patients is terrible. They can't see our faces. I have a confused patient that doesn't know where they are, and I'm covered head to toe in gear. It's so sad. Yeah. It's really sad all around. And then our patients are isolating at work because no one can go in the room, and it's very minimal.
Yeah.
How bad, go ahead, Chad.
No, I was just about to say, thank you for doing what you're doing. Very much. Being there for these people. And being there on the front lines, it's just, thank you.
Yeah, it definitely takes a special kind of person to do what you do and to still show up. You know what I'm saying? Like, my God, just amazing.
Yeah. And, I think we see everything that's going on in the news, right? That you turn the news on and it's just all negative. People dying. This is what's happening. This is how horrible it is, and then the politicians and all this stuff, right? What exactly is really going on from your perspective? What you're seeing just in the area you're in, It's
wild. Just on the news the other day, they said 26% of the cases in New Hampshire are healthcare workers. Wow. And it's not just nurses. It's all of our staff. It's our pharmacists. It's our cleaning crew. I wouldn't be able to do my job without the people who I work with. And it's difficult. There's all sorts of different cases, mild cases, people who are still up and independent. And then there's people who are my age or younger than me who are prophylactically intubating because they can't breathe, which is insane. Like that, I have never seen so many more advanced cases in a younger, more healthy population. The fact that we're turning some units into an ICU unit is scary to me. It's more of a realization like this is going to get bad. We've created an overflow unit in a parking lot with tents because we're anticipating such a high volume of patients to come. That's scary. Yeah. I would be lying to you if I said I wasn't scared. I'm scared because I have small children. My mom is older. She's not in the best health. This is concerning.
Yeah.
Yeah, I know. I got goosebumps when you're saying it. I mean, I can relate. You know, our parents, your mom, our family. Yeah, I mean, pretty much everybody is going to possibly get it at some point, I would imagine. You know, if you haven't or not, like you went through it. It was just minor for you, but your really good close friend you told me today went through it, and they lost all sense of smell, taste for a whole entire week, right?
Yeah, hers lasted a lot longer than mine. Yep.
It's crazy. So what are some of the people that you're seeing right now coming in? They just can't breathe, right? They can't breathe, and
they can't keep their stats up. They're just all around decompensated. Even if I know the majority, I must say, do have other health issues. People need to realize that these people who are dying from this are not healthy. Well, the majority of them are not. I can't say aren't. They aren't all. If you look at New York City, you have to take into consideration the higher pollution rate, the more smoking, they're in closer proximity to each other. The population is far higher than anywhere else. So yes, it's affected more people, and that's scary in greater numbers, but it's just, honestly, it's situational at this point. I think it's situational. We're seeing a lot of the same things when it's really bad and the lungs are greatly affected. It's something we're learning about. There's so many new articles coming out. ER doctors, like I follow one of our ER pages, and there's so many new articles that we're encountering and discovering new things and processes for handling things, and people with their breathing issues in a different capacity than we were before, because this is all new.
Man,
nobody has the right answer at this moment.
I was going to ask, like, you know, from your standpoint and what you're able to, you know, observe and learn, like, how is this virus behaving, and how is that different from other viruses that we've seen in the past?
Oh, that is tough. Yeah. I read some what we call our ID doctors. They're infectious disease epidemiologists, if I can even say it correctly. They follow that more closely. They're the pathophys and science guru. I don't know. I think it's just running rampant. I've been working closely with the state because they follow each case of COVID. So I've had to connect with them and do follow-up. In order to return to work, I had to be fever-free for 3 straight days and have no symptoms, or have no new symptoms and have improving symptoms, which I did.
Yeah.
And I asked them when I was on the phone, I had asked if they had any repeat cases. And she said, well, no, not yet anyways. So we don't know if we can get it twice. She said I should have some immunity, but we don't know. That hasn't been studied yet. We're working on it. It's new.
Certainly hope so.
I don't know. I think it's everywhere. She said to me on the phone, she's like, this is just community-based right now. Even though my hospital is doing their own investigation, obviously, considering we're all coming down with it, the state says it's just communal. It's everywhere. There's like really no stopping it.
God.
It's scary. It's just like that movie with Matt Damon, that virus movie that was very similar to this. I think it came out in 2011, right, Josh? Johnny?
I forget.
Had Matt Damon in it. Yeah, it was exactly the same thing, but it would spread by viral and I think by touch or something like that. It was very similar.
It's crazy though.
And it's scary when these movies depict certain real life things like this, and then years later, here we are going through the process. I don't know. It's interesting. So, you know, they shut everything down, you know, for a month, or it's been 2 months almost now. So coming up, I think things maybe start back up in May. I'm not sure. People are, you know, obviously in the medical field going back to work, but I mean, I don't know.
Peaked yet.
Exactly.
What's concerning to me is that I've been a nurse for 5 years. I've been in healthcare for 9 years, and I've never seen the hospital census this low. Like we don't have a high volume of patients right now, which is insane. Like we've always been full. I've been at the same hospital for 2 years now. And the fact that we have a low census, one, because we're not doing scheduled surgeries, so it's lessened our load, but also people who don't need to come to the ER aren't coming to the ER. People who are really sick come in. But the fact that they're preparing for a huge influx of patients, and the fact that they made an overflow unit when our census is next to nothing, is so concerning to me as a nurse. That is so concerning.
Yeah, because it could be coming then, right?
That's what we're planning on. They keep saying and reporting that we haven't hit the peak yet.
Yeah. Man, that's crazy. It's crazy to think about that. Hopefully it doesn't get to that point, you know? I mean, let's remain positive in a sense, but the realism is it could. And you're absolutely right. If it hasn't hit that peak yet, you know, obviously they're talking about seeing declines in, you know, the amount of people coming in, maybe based on this isolation that's going on. I really don't know. I mean, you know, there's no vaccine for it. There's no, nothing. I mean, you pretty much get it. It depends how your body operates, how your immune system is, basically how you break down how your lungs are, you know. Now you have a small case of asthma, right? And it didn't affect your asthma or anything like that?
No, I was so surprised because usually when I get a cold, I get a terrible cough, and I'm so surprised that it wasn't bad at all.
Wow.
Interesting.
Very surprised.
Wow.
Maybe you just have a great immune system.
God, I've been around people, working closely with people. You do build up some immunity, I would hope, anyways.
Yeah.
But yeah, I mean, we don't know how it spreads. We don't know how long it's suspended in the air for. We don't realistically know whether it's truly, you know, respiratory or droplet or what type of isolation or contact. It's a puzzle.
Yeah.
It's all.
When you found out you had it, I mean, what went through your head at that moment? Was it like, oh my gosh, this is...
I guess it was kind of a relief in a way, to kind of feel relieved, almost like, okay, this isn't bad. I'm okay right now. I'm glad I've gotten it, and I've gotten it out of the way. Cause I mean, I'm working with COVID positive patients. I'm working on isolated units that are strictly for COVID patients.
Yeah.
It was kind of a relief. Just, my mom had been watching my small children for a week prior. Like she knew I was continuing to go to work. She wasn't working. She's a teacher. Schools are closed. So it was kind of a relief in a way. I mean,
it makes
like for me, honestly, day to day, I'll hop on Facebook or listen to the news and I'm just paranoid. It's like, oh my gosh, this is the worst. You know, I'm putting hand sanitizer on. I'm using alcoholic wipes on everything. I'm wearing gloves. Like,
gloves. Oh my God. Can I just tell you, as a healthcare professional, it drives me insane when I go to the store. I see people with their masks on, and it's like, it's not covering their nose. So I'm trying to figure out what they're protecting themselves from.
yeah.
What they're trying to accomplish. I'm just curious. And then they have their gloves on, and they're touching everything. You know how many times I change my gloves? Not only like when I'm even just working with one patient, all I can do, like, recommend is wash your hands, use hand sanitizer, wipe down your frequently touched items, your car keys, your steering wheel, your phone. But I feel like the gloves are a slight bit unnecessary. I mean, as long as you're not touching your face or like eating food with your hands, like after you leave whatever store you go into. Yeah. I mean, think about it. All that stuff you're touching with your gloves on at the grocery store, you're going to put on the same conveyor belt as everybody else. And like the cashier's going to check you out. So what are we really doing?
Well, see, I was going through some of I was taking this time to clean my house. Like, I need to get rid of all this junk. And I go under the counter and I see a box of latex gloves. I'm like, oh, I gotta put these on now. I will stop for you. I will stop.
I mean, I guess you get out and you pump gas, and like that's a quick task. You're good to go. But I don't know. Just use some hand sanitizer. Wash your hands. I'm all for people wearing a mask. Just make sure it fully covers your nose and your mouth, and you're good.
Yeah, right.
That.
Yeah, I always love people that like will go and they'll touch everything in the grocery store or wherever they are in a place, and then they'll take their phone out and put it right to their face, like or they'll be texting or looking at something. It's like, what?
I'm watching them going to the grocery store. Literally, the other day I was cleared to go out in public on Monday. I was off isolation. I had been alone for 9 days, and it baffles me, all the stuff I'm seeing. Everybody walking around with their gloves on, touching everything. Like,
man,
that's crazy. Well, we thank you so much. You know, I love you, and you know, pretty much was raised with you. So I think, you know, just doing what you're doing from the perspective of us sitting here, and you're, like Chad said, Johnny said, you're in the front lines. I mean, you're continuing to go to work. You're going back to work tomorrow too, right? You're getting right back into it.
Yep.
So mad props to you. Thank you for everything that you've done. And, you know, we love you.
My pleasure. I love what I do. This just makes it's hard for all of us. All of my coworkers. I wouldn't make it through without my fabulous coworkers, honestly.
Yeah. Thank you, Caitlin. I know you got to get ready for work tomorrow, so really appreciate you like stopping in and talking to us for a little bit and just kind of like giving us a little bit of insight on what it was like and what you went through and what's going on in the reality of everything, because we don't know. We've been locked up. We don't know what's happening.
Look at it. I am thankful I get to get out of the house. It's scary. I'm terrified at the same time, but it's worth it.
Yeah. All right. Well, stay safe and please just let me know what's up. Text me and let me know as you go through the process of everything. And hopefully you just, I hope it's a virus that's like a flu where you get it, you become immune to it. And then, next year there's something new. It's like done with that.
There's different strains of the flu A, flu B. So who knows? Maybe before this is over, God knows I could get it again. We just don't know.
As a different strain. That is totally true. And that's something I want to follow up with you later, because I heard there was a new strain, or there's a new strand right now going around of flu this year too. Somebody just got it recently.
Terrible.
Yeah, I heard that.
Patients. Mm-hmm.
I think it's flu type A or something like that. Someone was just talking about some new flu. Yeah, type A, but it had a new strand. It's like something completely different. But
it's been a popular one this year.
All right, so here's the plan. We all move to Mars, and we will know we all have just whatever flus and bugs and whatever we got, and that's that. And then we have to deal with it.
Yeah.
Chad, do you know anyone that could build a rocket?
I do. As a matter of fact, I do.
Can we call Homer?
Yeah, we can. Yeah.
All right, Homer Hickman, we're coming to your house.
Yeah.
We're coming down there to, where is he, Alabama? Start building the rocket.
Yeah.
All right, Caitlin, have a good night.
Thank you so much.
Guys.
Thank you.
Yeah,
thank you.
I'll talk to you soon. Thank you.
Bye.
Wow.
Man, it's crazy. It's interesting because, we sit here at our homes, we turn on the news, we turn on social media, and it's so hard, man, to watch that stuff. Like, politicians and the networks and whoever wants to tell the right narrative from their perspective. And, it drives on a lot of negativity too, and a lot of drama. Yeah. So it's like, what is going on?
My thing is, you don't know what to even believe.
Exactly.
There's one news outlet saying this, the next one saying that. I'm basing everything I know off of the dude I was friends with in 8th grade that was passed out at every party, because he's obviously an expert now on Facebook.
Dear God, I know.
Yeah.
It's just like, I don't even know what to believe. And it's this heightened sense of paranoia.
Bro,
constantly.
and that's what I'm constantly doing that too, right? But I always get as much news as I possibly can, and I'll read the same damn articles basically from different outlets or whatever. And I always think, okay, yeah, this one's saying this and this one's saying the exact opposite. And the truth is somewhere in between, right? And it's up to us then, the consumer, to suss through that, which is fucking sad that we have to even do that. News should just be given to us, and we should be able to take it, accept it. But it's not the case these days. We have to make that, we have to split that parallel somehow. And it's really, really weird. But that's kind of the reality that we live in nowadays.
Well, we're doing our part right here by telling the factual information of what's going on from a real person who's really working in the medical field and is actually there, and got COVID-19 too.
Yeah.
Went through the virus, went through the experience, and is able to talk with us about. So, I mean, that's real. You know what I mean?
Exactly. And I just think it's important for people to remember, like I tweeted something yesterday and I'm like, I don't like it when people, are like, oh, I'm so bored right now, or, oh, I just, I don't know, like your cousins, like out there doing the real thing. Like, you should be thankful you're able to be at home.
Yeah.
You know what I mean? Like, really, you're bored? What are you bored with? Like, this is life and death. Like, you know what I mean? This is a chance for people to like reinvent themselves and figure out like follow some other passions. And like, it's hard, man. People are losing their jobs. This is life changing. And I just, I want people to like, not just dismiss it like that. You know what I'm saying? Like, what do you have to be like complaining about? Be thankful. Be thankful for your life.
Exactly.
Yeah, for sure. For sure.
Right, man. G Crew.
Yes.